watching Let's Chat.
Time to find out more about this health survey we talked about a couple of minutes ago, and Jamie Burley is joining us here along with Zeke Garcia. Good morning to you both. Hamilton County Health Department teaming up with UTC for a community-wide public health survey. I know this sounds fairly simple, but like anything else, I know it isn't. Tell me exactly what's going to be going on with this.
Yeah. So the survey is going to be, is now open and for our residents here in Hamilton County. It's a short questionnaire of about 35 questions in an attempt to find out what our residents are currently facing post-pandemic. The questions focus on chronic disease, mental health, substance abuse, and access to resources such as affordable housing, healthy foods, and healthcare, and much more.
Zeke, anything you want to add to that?
Yeah, so it's you do have to be 18 and over and a resident of Hamilton County. So something that we want to reiterate is that we are not going to be asking for any personal information in the survey. It is completely anonymous, so we want to get the feedback of everyone in our county.
And you are talking all throughout the county, and not just folks who may not be as fortunate as others. Doesn't matter whether you're living in the highest mansion on Lookout Mountain or whatever. Your input is needed, correct?
Correct.
What are you going to do with all this information once it's assembled?
So the data, the survey is available on links and QR code. We do have printed versions available if necessary, but when they fill out the link or the QR code, it comes in real time. So then we're able to analyze that data and we look at the zip codes, and like you were saying, we really want to make sure we get responses from every person in every zip code across the county. So we will look at the data, and where we see low response rates in certain zip codes, that's where we're going to target our outreach efforts, where we'll go door to door starting this Saturday, April 15th.
Zeke, add a little bit more to this about why it is important to get such a cross-section of the community from the socioeconomic standpoint.
Well, we know that during COVID, people felt that they weren't being heard, and so this is an opportunity to have everyone get their opinion, how what do they feel needs to be changed, or what we are doing good and what we need to make changes. And so that is what the survey is going to help us. Any
rough idea of how many respondents you've had so far, if you had to ballpark it?
As of this morning, we had over 1,000 responses since last week.
Yeah. And it has not been active all that long, correct?
We went live last Monday. And we've been doing some media stuff last week and
good.
this week.
I hope this blows the cap off of this. When the results are completed and all the data is compiled, can the folks who took part in the survey look at the survey results itself? Is that going to be available for public consumption?
Yeah, that's a great question. These results will feed into the Picture of Our Health report, which was last published in 2019. So we hope to publish the new report at the end of this year, maybe the beginning of 2024, and that will give us a really good snapshot of what is currently our residents are currently facing, and so that will be available in a report on our website.
Has UTC and the health department ever teamed up to do something of this magnitude before?
I personally haven't teamed up, so this was really an exciting project to work with UTC, Dr. Dawn Ford, and her Masters of Public Health program.
Right.
We've been working on it about 6 months now. So we're really excited and really excited to see the results that we'll get from our community.
I'm excited to take the survey and to see the results as well. Jamie and Zeke, we got to leave it there because of time restrictions, but we hope you'll come back after the survey is concluded and fill us in on what you found out. When's the last day to take it?
It's currently going to be open for a month, but we have the opportunity to extend that because the biggest thing about this survey is getting as many responses as possible.
Sure.
So we may leave it open a little longer.
Find out more at health.hamiltontn.org. That's health.hamiltontn.org. We'll be right back with more of Let's Chat after this.